your local friendly clinical informatics hero fellow, and my name's Lee. So my vision is for all Australians to be able to access quality healthcare. And really my objective for my Hero Fellowship is to enable sustainable and health service improvement through digital health and workforce transformation. So this was a mission that started, some 20 years ago, because I'm a doctor by day, but I'm actually a nurse by night. And I work in primary care on the northern Gold Coast, and we've just been commissioned by the federal government to transition into a Medicare urgent care clinic like 55 other sites across Australia to make healthcare more accessible and bulk billed available into the evening and on weekends. So I'm proud to kind of be part of that on the front line. And I guess for me, everything that I do clinically and also with my research program is around addressing or working towards achievement of the quadruple aim. So back in my PhD, I had the opportunity to go over to Scandinavia to learn around user-centred design, co-design and design thinking, which stemming from my very kind of collaborative and multidisciplinary focus as a ward nurse, really aligns well with my mission, that we can achieve a better future for our current population and our future populations if we work together on these wicked healthcare problems. So I've worked in 3 Australian states across public and private acute care and in acute and also primary care. And I'll give you one guess as to which workplace has the most digital workflow as a clinician. Yes, it's actually here in Queensland in primary care. So I use best practice, and I'm not being paid to say this, but my digital footprint is massive in primary care, and I'm really excited about the opportunity for primary care to take the lead in this space for more kind of preventative and holistic and kind of culturally appropriate care closer to home. So I have been with Claire's digital health group for 3 years now when we were an N of 4, and I had the opportunity to have a postdoc here. I relocated up from Sydney to do so. And really my program of research was around digital maturity, so assessing the current state of Queensland Health's HHSs, so health services across the state, and really unpack, well, what is the foundation that we have developed here and what could be the future strategic investments that we need to continue with in terms of healthcare improvement. We were able to evidence some very impressive patient safety and quality markers through analysing our IMR implementation from a quantitative perspective, and we're really pleased to evidence the improvements in infections and medication complications for our inpatient cohort. We also worked with the health informatics team to define, well, what are those benefits across the different stakeholders as we work towards achieving the quadruple aims in terms of digital healthcare improvement. And then if we look at the other side of the quadruple aim, the human side, so the provider experience and the patient experience is really where my heart sits. So this is around supporting our current and emerging workforce in defining, well, how can they best leverage digital and data to improve healthcare in their respective context. I had the opportunity to do a fellowship with the Australasian Institute of Digital Health and have 1 year with the Australian Digital Health Agency, which is a federal government agency, to define the skills and requirements and behaviours of nurses and midwives in Australia to enable this transformation. And more recently, working with AIDH as well on developing a clinical informatics fellowship so that we can have the leaders to enact to the change leadership required in different contexts to change practice going forward. And in the consumer space, I do a lot around consumer intervention design and for clinicians as well through dashboards and apps, and that's where my co-design methodological expertise comes in. So currently I'm working on some rural digital health work with some colleagues across in the business school as well, which is wonderful, exploring how we might best support our rural and remote health services to transition to digital. So traditionally, the investment in digitisation has been metro or large regional city focused, which is wonderful. Yet there is a whole workforce out there working tirelessly around the clock under quite an enormous amount of pressure that need support to better leverage data and digital as well. I had the opportunity to go up to the Torres and Cape HHS and learn around the primary healthcare delivery models up there, where we see just an incredible and inspiring and resilient health workforce delivering culturally appropriate care for the communities up there. And in terms of the clinician experience and provider experience, I'm working with Oliver here on a systematic review defining what that is in the literature and how we might translate that to Queensland, to the Queensland context. Thank you.